Good afternoon and welcome to the Subcommittee meeting for technical assistance of the Governor's Interagency Advisory Council on Homelessness to Housing. This meeting has been publicly noticed in compliance with Nevada's Open Meeting Law, Chair, Co-Chair, Vice Chair Brooke Page. Will you call the meeting to order?
Thank you, Carlia. Good afternoon, everyone. It's 1:05 p.m. on February 18th, 2025. I'd like to call the meeting of the Nevada Interagency Advisory Council on Homelessness to Housing Subcommittee for Technical Assistance to order. Carlia, would you please take roll?
Chairwoman Michelle Fuller-Hellauer. Vice Chair Brooke Page.
Present.
Austin Pollard.
Present.
Dr. Pamela Janelle.
Present.
Chris Murphy.
Present.
Christy Costa. Kimberly Martin. Adrian Babbitt.
Present.
Julie King. We do have quorum.
Okay, great. Thank you so much. Thank you, members, for joining us. It was kind of a little close, but we'll move on to agenda item number 2, which is public comment. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making a public comment via phone, please call in at 1-775-321-6111 and use the ID number 489-058-294#. We are now open for public comment. Please unmute yourself and state your name for the council. All right. Anybody want public comment? Any comments? Anything on the phone lines, Carlia?
No, not seeing anything.
Okay, well, we'll close agenda item number 2, and we will now open for agenda item number 3. This is an action item, discussion and possible approval of the minutes from January 21st, 2025. Members, does anybody have any questions, or would anybody like to make a motion related to our minutes?
Adrian Babbitt, I move to approve the meeting minutes from January 21st.
Awesome,
Austin
thank you.
For the record, I'll second it.
Awesome. Thank you, Adrian. Thank you, Austin. Any discussion? All right, all those in favor say aye.
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 Any opposed? Nay.
Yes.
Any abstention?
Chris Murphy for the record, I'll abstain.
Okay, Chris, thank you.
I wasn't present.
Okay, makes sense.
Dr.
All
Pam
right.
Janelle, for the record, I say aye.
Okay, thank you, Dr. Janelle. All right, that motion passes. We will move on, close agenda item number 3, move to number 4. This is also an action item, discussion and review of the subcommittee member commitments, attendance, and vacancies for possible vote regarding the applications that were received on filling the 4 vacant seats to complete our membership at 13 members. So thank you so much to the staff for helping get out. We had nominations that went out and information on a few candidates. So I'll turn it over to you, Carlia, to walk us through this agenda item.
So we received 2 applicants, Dayana Turner and LaJoy Whitsett Gage. They received a total scoring of Dayana received a total scoring of 77 and LaJoy a score of 57. Okay. We received votes from all subcommittee members except for Christy Costa and Kimberly Martin.
Okay. All right. So do we have any discussion on the two candidates that we're considering today for possible action?
Dr. Pam Janelle, for the record, when you speak of those scores, are those like just total aggregate scores or are those averages? Because I do know the ranking is like 1 through 5 for several items. Can you just further explain that for individuals who may not have gone through this before? Thank you.
This is the total scoring summary. It's not on average.
Thank you.
This is Adrian. Can you share, is that out of 100 or how, like this? I'm not familiar with total possible score versus score achieved.
They were first aid kits.
Sorry. The scoring, honestly, I'm unsure. Abigail, she normally does this portion of it. She had to go to a last minute appointment. So I'm not sure how it was scored. I just know that it wasn't based on an average. It was this is the total based off of how you all answered or scored. This is the total number that it is. Oh,
Okay, so
Ryan,
it
you had
looks
it pulled up?
like,
Oh, Ryan has it pulled up.
oh, thank you, Ryan. So per each member, total score was 20 for full points for each person. And then how many people submitted scores? I think you said we're missing 2.
Yes.
So that's 7.
Yes, Dr. Janelle, for the record, that was what I was alluding to, because
Okay.
you just have like this big number, but then it would be nice to know like what the average score was based on like each member voting. So you have like the 4 items here, and then you just have big numbers down at the bottom without the process in the middle. So that was just where I was a little, because this is the first time I've seen any of this, just to kind of see like, for everyone who submitted, scores on the spreadsheet, like, could we see like how those were calculated, I guess?
This is Ryan. This is all Abigail provided me with. I think she was waiting for the other part of it, so I don't believe she has that right now, but I can follow up with her when she is in next.
Okay, Dr. Janelle, for the record, thank you so much for that, because that's useful information.
Ryan,
Especially if we're considering new members, I would like to know, like, because there's like a 20-point difference between each of these candidates or applicants, and it would be nice to know where those differences occurred. Thank you.
Brooke, for the record, so it sounds like if 7 people scored, that would put a total of 140 if it's 20 points each. Instead of 140, it looked like there was 77 and the other one was 51. Carlia?
57.
57. Okay, out of 140. If that's the logic, but members, do we feel like we have enough information to make a decision today on these 2 candidates?
Dr. Janelle, for the record, because there's data missing and there's a 20-point difference between the candidates, I would like to, just kind of discuss that so that I would have some understanding, because I don't even know, like, what is our cutoff, or is there a cutoff, or, a threshold that needs to be met. Those are some of the things that I would love to have more information on, so that I can make the best informed decision with regards to these candidates. Thank you.
Okay. Any other thoughts on that?
This is Chris Murphy for the record. If this isn't a pressing issue, then I would say maybe we make a motion to table this till next month, where we can have all the information to make that informed decision, and just see if we can get the average score for each category, so we can see that for each candidate, be able to see the differences. Is 20 points is big.
Mm-hmm. Yeah, and if it's out of 140, but doesn't put any of these candidates over like 60%, if that's the average, I mean, if that's the total. So, okay, is there anybody that wants to make a motion then to table this?
This is Adrian. I have a question before we move to a
Yeah.
motion. Are we ongoing accepting new interest lists, and are we able to do outreach to maybe community individuals that we think might be interested in participating, to invite them to apply? Or I know that I believe that I was told that this is an ongoing open interest list, but then that out of 26 interest letters, only 2 submitted their actual letters. So I'm just wondering if there's additional opportunity to outreach to some of those folks. Maybe it was a short time constraint, or just wanted to get some more information on, because we have 4 positions open. And so I anticipate this is going to be an ongoing need. Thank you.
Mm-hmm.
This is Dr. Janelle for the record. I agree and concur with Adrian's thought with regards to that. And knowing that there were 26 individuals initially, we do know that with certain organizations, there have been transitions. And so knowing this, I do know we did have a brief discussion in our last meeting on record, where we did discuss maybe looking at doing like ongoing recruiting at a more consistent basis. So I just wanted to add that as part of the discussion here prior to the movement. Thank you.
Mm-hmm. Okay, well, Brooke, for the record, from what I understand, this is an open application process. And so I think, to your point, Adrian, it would be beneficial for all of us to be identifying folks who could possibly be a good fit for this body and to submit their interest. Carlia, if you could help us maybe as get out the process, that if somebody is interested in joining, like if there is the ongoing link or the notification that we could share amongst our networks so we can help recruit, that'd be helpful.
Yes, of course, we'll get that emailed out.
Okay.
Hey, Brooke, this is Adrian again. But also part of this item, I think, was the outreach that was being conducted for members that have not been participating. Is there an update?
Yes.
At all
So
to
I
that?
want to move to that one. I just want to finish
Okay.
out this topic.
Sorry.
And then we can move. No, yes, great question. Then we can move to the current commitments. I did vacancies first, I guess. I should have done that last.
Got it. Well, then in that case, this is Adrian. I move to table the approval and voting of new membership to this body until next meeting.
Dr. Janelle, for the record, I second that.
All right, any discussion on that? All right, seeing none, all in favor, say aye.
Aye.
Aye. Any opposed?
Aye.
Sorry, I keep cutting you off. All right, any abstention? Okay, so we motion carries. So we'll table this topic for the vacancy, filling the vacancies, to the next meeting, and add that to our agenda for next month. So as far as the commitments, the current membership and the current attendance, Carlia, do you have some information for us about where we stand related to our existing members and the current attendance?
We did reach out to Christy Costa and Kimberly Martin regarding their resignation from the council. However, we have not heard back anything. We could reach back out to them to follow up with them.
Okay, so I think the process from what I recall was we would notify them of their attendance concern and
We did.
so that piece has been done. And then the next step, is it for this body to sort of vote based off of that outreach, or do we have another step there that we need to do another follow-up?
Dr. Janelle, for the record, well, in full transparency, when it was found that I had because I work for Nevada Department of Education, and we would have our division meetings at the same times of this meeting. So I would have to attend my division meetings instead of this one. It is my understanding that there was some outreach, and then there was like some discussion with regards to like supports. And I know it's different for each individual, but I just wanted to kind of share that. So maybe that would lend itself to the process because, I, kind of gone through it, and that we were able to find some remedies and with regards to some of the things. And I'm here today. So maybe
Yay!
that will be helpful. Maybe that will help with regards to the discussion with the steps. Thank you.
Great, thank you. Adrian?
I think it was explained by Ryan last meeting that the outreach would also include notification that we would be voting on their continued participation. So just looking for validation that that's accurate. And then 2, looking for just a refresher on the last meeting that Christy attended, because I don't recall that information.
This is Ryan from the Attorney General's office. So the bylaws for the committee say that when a member has not participated in at least 75% of meetings with any 12-month period, the chair will send a notification letter to the member that the council intends to take action at the next scheduled meeting. At that meeting, the member will have an opportunity to refute the action, or the council will proceed with the removal process.
Okay.
Thank you, Ryan.
So yes, I mean so Adrian, yes, you remembered that correctly.
Thank you. Brooke, can you tell me if that action was completed, that we sent that notification, or was it just outreach on asking for resignation? And I just want to be clear.
Yes. So it sounds like staff has sent notification, outreach to the members that their membership is up for discussion, is what I was under the impression went out. That first step. So, and that they would be discussed at this meeting. And so this is the meeting that I'm under the impression we have the authority to sort of make a decision if we want to vote them out or not. Or as Dr. Janelle mentioned, do we want to provide them with some accommodations or further time to sort of understand their commitment? Like you, Adrian, I haven't seen Christy or I can't even recall who Kimberly is to participate in a meeting. So I'm not sure if we just, in the interest of time, want to move forward. So I see some hands. So let's go with Chris, you first.
Do we know when that was sent out? So we can actually look and see if they have we've given them an appropriate amount of time to respond.
Mm-hmm. Great question. Carlia, do you know when that letter was sent out?
Yes, we have reached out to them January 24th.
Okay. And you haven't heard no response from that communication? Okay.
Dr. Janelle, for the record, were there any automatic responses or anything? Because I do know that when I send stuff out on my listservs, it says this person is no longer in this position or this person is out until such date. I was just curious to know if any auto responses were a part of that. And then I would add, because we do have members who have different obligations, it's important, very important to take that into consideration or as like a case by case basis. But I do know time is of the essence as well. And we are in the middle of legislative session. So I do know the circumstances would vary depending on, also what's going on presently. Thank you.
Do we feel like that's enough time? From January 24th to today. Any thoughts about that?
I could read to you all what we sent as well.
Yeah, that'd be great.
Okay. Good afternoon. We are reaching out to you on behalf of the ICHH Subcommittee for Technical Assistance. The subcommittee has noticed several absences, and we encourage your participation and attendance in the meetings. Without our ICHH-TA members' attendance, we're at risk of not having quorum in monthly meetings and achieving the goals of the subcommittee. The ICHH bylaws state council members must participate in at least 75% of meetings within any 12-month period, and the ICHH subcommittee strives to align with these bylaws. We appreciate your efforts into making this successful and look forward to seeing you at the next ICHH-TA meeting. However, if you choose to resign from the council, please reply with your written resignation from the subcommittee, and we'll make sure the chair, Michelle Fuller-Hellauer, gets it. Please let us know if you have any questions or concerns. Thank you. And that was sent January 24th.
This is Ryan. I think that letter, as you read it, falls short of sending notification to the member that you intended to take action at this meeting to remove them. I mean, unless I didn't catch it and you said that, but I don't think it says that, does it?
No, it doesn't.
Yeah. I think you're going to have to afford these people a little bit more due process. They're going to have to be sent something specifically saying that you're going to be taking action to remove them at another meeting, and that they will have an opportunity to come and refute the action. I don't think it says that clearly enough for you guys to be taking that action today.
Thank you, Ryan.
Yeah.
Okay, so that resolves that. So, Carlia, can you and the team send out another communication to Kimberly and Christy, letting them know that the language that we need to kind of be more firm about, that their membership will be up for consideration at our next meeting?
Yes,
due to a lack of responsiveness. Okay. All right. So we've kind of put that to bed for that issue. And then, well, depending upon that, we already have 4 vacancies. So we'll have to really consider what that looks like between now and then. So I think members, if you've got some ideas for possible membership to this committee, it'd be great to bring some other folks to the table. So with that, let's go ahead and close agenda item number 4, and we'll move on to agenda item number 5. This is also an action item where discussion and possible action regarding the alternative ways or format of presenting the action plan. And so from my recollection, we sent, the staff sent out examples of 3 different formats that we discussed at our last meeting to present the information of the action plan and to kind of figure out how we want to move forward in some different options. And so now we kind of need to make a decision on either of those, and if anybody has any thoughts or other alternative ideas, we want to be able to figure out what format we want to move forward with on the action plan. So has anybody had a chance to review those 3 options and have any thoughts?
Brooke, this is Chris for the record.
Yeah.
I did not receive that.
Oh. Okay, well, that's not good. Carlia, do you have that information about that went out to the subcommittee members?
Yes, I do. It was sent out January 22nd, and I could resend it out to the members if you like.
Okay. Thank you. Was there anybody that received it that has any thoughts about it? And we can go over that information again if it's helpful. So it had some there was an Excel spreadsheet and 2 links to examples of how other communities are synthesizing their data. And so the first one was a format that we've been using in a few of the other TA work groups or the subcommittee work groups for housing. And so this one has the strategic issue of housing, the goal that's intended to be achieved with that, and then the various there's like a lot of goals in housing, but there's about 6 different goals. And so for each goal, there's a subsequent action that needs to take place. And based off of the feedback from the work groups, these are the various different actions and any comments from that. And then the next step would be, obviously to identify a timeline and which action type. Is it legislative action? Is it advocacy, administrative changes that need to be made? That would sort of be the next iterative process to this. But this was one way to articulate our action plan. And then there was the other 2 examples. One was more of a condensed version that kind of shows what is the goal and then the various different actions kind of beneath that, and then the status. Very simple, like a more simplified version here. And then the third one was a bit more in depth. So this community has an overview of all of the various different, like these would be our strategic issues essentially, in these different color codes. And then the objectives of each one of those strategic issues. And then you would break down each strategic issue and the various different activities or actions that need to be done under each one of those goals. Who's leading that? Who's collaborating? The time frame, and if there's any performance benchmarks. So this is the third version. This one's probably the most detailed. So you got simplified. I would say this Excel spreadsheet is a bit more mid-range.
Mm-hmm.
And then that third one is a lot more detailed. This one. So any thoughts on this one, Dr. Janelle?
Actually, I think, is it Adrian? Her hand was up first.
Oh, okay. Sorry, Adrian.
No, it's okay.
So I'm of a mind that we need 2. I think that
Okay.
I like the progress one, like the really simplified one, because it's easily digestible for people that are interested to know what the work is that's happening. But for others, for tracking purposes, for benchmarking, I think that we need a way to like expand that or to further be able to document and track the work that's being done. So I think it's both. And I mean, I don't really have strong feelings about, the Excel spreadsheet versus the PDF one. I think we need to look at what information we feel like is valuable to track, and then build it to that our specifications. But I do think that we need this progress, really simplified way to share out this information.
Mm-hmm. Great. Thank you, Adrienne.
Dr. Janelle, for the record, Adrienne, I think we're like spirit animals of the same mind. And I do actually recall this being in our last conversation. So thank you for sharing the documents again, because my computer was tripping and it wouldn't let me look at them.
Oh.
And yes, so I would like to just reinforce or reiterate that simplified version would be very good for public facing as well as outreach. Like let's say we're recruiting new members, that simplified version would be really helpful in communicating, where we are and what we're doing. Where on the back end or our in-house technical assistance committee, in terms of tracking what we're doing, like for instance, a project plan, we would be able to dissect each of these strategic issues and the corresponding action steps, and then also like who's doing what. And then I do know that was something that we were planning on doing with regards to whoever the leads are, like the rest of the group get behind them in order to help like move those strategic issues and action steps forward, hence the survey, as well as the results of the survey that would tie back into those two pieces that we would work with, the public facing and then the back of the house, more intricate, detailed work. Thank you.
Great. Thanks, Dr. Janelle. Any other thoughts? Welcome, Julie. Any other feedback? Yeah, go ahead, Chris.
I really like how you did the spreadsheet. I did find the email. I apologize. Once I knew a date, it really helped. But how you broke it into housing prevention and policy and listed all of our goals and our action steps. I think as far as having the detailed version and having those three categories, it makes it really simple. So, I agree that the two is beneficial, especially just because of the vastness of the information that we're talking about.
Mm-hmm.
And that's all I have.
Great. Thanks, Chris. Okay. Well, it sounds like from those that have spoken, it'd be good to have a simplified version and a more expansive version, maybe for this work group to keep track of what we're doing, but something external facing, having the simplified version would be helpful. I'd liked Adrienne's comments about what information do we need that's important for us in order to track. So that way things are customized to meet the needs of our community. And so maybe that's something that we could add for our next meeting. Maybe folks can come to the meeting prepared with some ideas about what information we would want to track on a more detailed version of this of a PDF version or a spreadsheet version, and we can kind of hone in on the information that we want. So do we want to make, this is for possible action, do we want to make a motion on moving forward with the two types of documents, one condensed, one more expansive?
Dr. Janelle, for the record, I would really love to hear what the other members have to say about it, simply because this would be something we would all be using. So I would love to, hear more from our thought partners as well.
Right. Anybody else have any thoughts? Julie or Austin? No?
I don't. Sorry.
Okay. All right. Well, anybody want to make a motion?
This is Chris Murphy for the record. So moved with having two versions a simplified version and one that tracks the action items that this committee deems appropriate.
Right.
This is Adrian, I second.
Great. All right. Any further discussion? All right. All those in favor say aye.
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 Aye. All right. Any opposed? Any abstain? Okay, the motion carries. We'll go ahead and move forward with that. And I think if folks could also be thinking about what they would want in a more expansive version of this, of a document, if you could bring those ideas to our next meeting, we'll table that for next agenda topics. Okay, moving on, we'll close this agenda item and move on to number 5. Actually, that's actually number 6. For information only, update on the poll survey regarding the top 3 action items from the continuums of care, providers, and individuals with lived experience of homelessness. All right, so we had a survey go out. I saw that survey. I responded to. So great job to the staff and everybody that got that out. Thank you. Any thoughts on that, Dr. Janelle?
Well, first of all, congratulations to our support team for pulling together all of the items. We were able to meet, I forgot how many Fridays ago. I think it was about 3 weeks ago, almost a month. We were able to, at least format it to, because a chairwoman was on there, and we had to kind of scrub things a little bit in order to get the 27 items that we had. We were able to condense them down into one. We had some demographic information where the participants would self-identify, and then also we had an item where individuals would be able to tell if they were north, south, rural, or if they wanted to identify another location. And then we literally took each of the questions, but we first were able to allow participants to sort with regards to level of importance, which strategic issues resonated with them, and then the top 3 action items within each of the strategic issues that were most important. They were able to sort them. So it was fun being able to do that, and thanks to the team for getting it ready and being sent out. I did send it out in my newsletter, and I didn't check the results, but I think we have over 50 responses. So I would love to hear from the rest of the team or whoever's tracking that to see where we are. Because I was able to look at some stats, but I want to hear from everyone else in the team as well. Thank you.
Awesome. Thank you. Carlia, do we have any stats on this item?
Yes, Ryan will be sharing his screen. Oh, there he goes, right there.
Great. Thank you, Ryan. All right, 57 responses. Great. Lots of COC members and service providers. Individuals with lived experience, we've got 8, community stakeholders, and other. All right, so great mix of north and south, but not a lot of rural, 8 rural. But considering it's rural, I'm wondering if that's still a pretty good number, considering. Okay. So please rank the statewide strategic issue listed below in the order of most importance. Housing, number 1, issue. 2, homelessness prevention and intervention, and 3, wraparound services. Yes, definitely feels like a theme. And then, but the next 2, which is not as close even to the top 3, but are kind of tied, is coordination of primary and behavioral health, education, workforce. Okay. All right. The next one for housing, rank the housing steps in the order of most importance. Number 1, identify permanent funding sources. Number 1. Number 2, develop multi-sector housing ecosystem. Number 3, standardized tenant selection plans, which is kind of not close. So that's interesting.
And Dr. Janelle, for the record on this, just so you know, the way that these are rank ordered in these results, they weren't listed in that same order. So we're literally getting, you know, if they were mixed up, people were able to move them up and down. So I wanted to be sure everyone was aware of that. So they weren't answering like literally in order as they were listed, but in order of like importance. So that's yay.
Yeah, right. Okay, thank you. So number 5, homeless prevention and intervention services, prevention funds, more accurately targeted for diversion and problem solving. And then number 2, capacity building on reentry and diversion programs and statewide master resources list to include MCOs and benefits. Okay, so this is some good clarity. And then the third one around wraparound services, engaging stakeholders to establish partnerships to leverage existing resources. And then better access to match dollars for service providers, and then training modules for law enforcement, service providers, and jurisdictions. Okay. Education and workforce development, top 3, incorporating training and certification programs. Training modules for law enforcement comes up again. And then creating a state youth advisory board, number 3. And then coordination of primary and behavioral health, identify permanent fund sources, that comes up again. Develop health homes for programs in Nevada, and coordination of data sharing for all programs. And then number 9, coordination of data resources, coordination of data sharing for all programs comes up again. Systems mapping, create a visual map identifying systems of care, and then gather feedback on what data from HMIS is most helpful. Interesting. So call out to you, Julie. We gotta work on that HMIS data. All right, and then number 10, policies, prioritize developments that build deeply affordable units. And then implement requirements and incentives for developers for deep subsidies and inclusionary zoning. Wow. Okay. Long-term planning, identify permanent funding sources. Number 1, again, y'all, funding has come up 3 different times in 3 different categories, but number 1 in 2 different categories. Ensure projects are working towards statewide goals via a tracking mechanism. Integrate lived experience and justice into governance program development. And statewide master resource list to include MCO benefits comes up again. So great themes. I think this gives us a lot of information and a priority that feels very clear. So thank you all so much for this. But again, this is 57 people have participated. Do we feel like we have enough representation to move forward with our work at this juncture? Any thoughts on that?
I'm actually, this is Julie King for the record. I'm actually kind of impressed that there were that many responses.
Mm-hmm.
I don't know how many people it went out to exactly, but I know, I mean, usually when you have some kind of survey out, you're like pushing to get just 20 people, you know, 57 seems like
Very
a decent,
diverse.
Yeah, and diverse across the different types of, you know, roles that they have.
Mm-hmm. And we're split with North and South. I love that because typically sometimes it's very much more South than North, or, you know, but this is a great mix. Yeah, good point, Julie. Thank you. All right.
Austin Pollard for the record.
Yeah, Austin.
I was thinking the same thing. I'm not sure how many people it went out to, but I do like the diverse mix of responses and just the information that's gathered. I'm excited about it.
Mm-hmm. Great.
Dr. Janelle, for the record, in looking at the individuals who responded with regards to, like, let's say COC members and stuff, and I'm looking at this data, it also gives me the opportunity to actually do more outreach with individuals with lived experience, more so, because when I'm seeing like a majority of them being COC members and service providers, one of the things that came up in discussion, because I'm on the education and workforce development strategic issue, is that how many of the individuals whom certain systems are designed, I mean, how often are they part of the process versus us imposing a process that's considered easier from a service provider standpoint? So even before we get into the strategic issues, I'm looking at who the respondents actually are in terms of numbers. And so to see, I hope that like with the other, I think people were able to type that in, but I'm not really sure. Like when they say, you know, identify as other, like what that is, and to actually go after that and get more information. But yeah, I'm really pleased, you know, with the group's work on this. And it looks like we still have like a few more days that this survey will be out. So I would definitely encourage everyone to just push this out one more time so we can get even more rich data.
Mm-hmm. Great. And it looks like folks were able to respond more than once in terms of how they identify as far as housing in the housing and homelessness sector, because there's more responses there than the part of Nevada. So, okay, so I agree. If we could do a last push and just get as many folks, but this is a good, you know, good representation, maybe some more folks with lived experience, it'd be good to get more voices into this as well. All right, any other thoughts? All right, hearing none, we'll move on to the next, close this one and move on to our next agenda item, number 7, discussion and possible action to identify, oh, why do I keep doing that? Or, oh yeah, it is the next one. Discuss and possible action to identify the top 3 action items for the Interagency Council on Homelessness to Housing to consider prioritizing moving forward. Okay, so we just saw the survey results. And we as a body have wanted to advance 3 topics to the Interagency Council on Homelessness to Housing, as you know, for them to start agendizing and talking about and helping to sort of figure out how we're moving forward with 3 of the goals that we've talked about at this level from our action plan. So is based on what we've saw with the survey, do we feel like we have enough information to sort of make a decision about the 3 items that we would want to start prioritizing for the Interagency Council? Yeah, Dr. Janelle.
Dr. Janelle, for the record, I do think that we do have some good information. However, I would like to, you know, not like, I wouldn't say abandon, but, you know, sideline the other items such as like, you know, the education and training component, like all of the other components are important. One question I did have is because we're in legislative session at this time, upon advancing this information to ICHH, would this information be used to, you know, inform what's going on in legislation at this point? Or is it almost like too late simply because we're already in legislative session? I'm just curious about that in the process.
It's a great question. I think, for the record, I think that there are plenty of housing bills, homelessness bills too, that have been introduced so far, that given you know, us moving forward with at least moving something to Interagency Council, there could be opportunities to leverage the current activity to even, you know, tie it to this work, and, you know, track it even more intentionally at the Interagency Council level. So I think that there are some opportunities for that. Any other questions, Adrian?
Hey, so I think that we do have enough information. Like if we had, I don't know, I can't remember if we polled the members that attended the meeting, but I think combined with those that took the poll at the youth conference and the community, like funding is repeatedly at the top of the list. And so I think even if we don't agree that we have enough information to propose all 3, like let's look at the most obvious top 2, or if it's top 3, like I think that we should not delay unless I mean, unless I'm missing something on the process, but I think we have enough information to propose what the top 3 action items should be, my opinion.
Thanks, Adrian. And so we've got 3 action items. That's the agenda item speaks to action items, because we had, I mean, there's goals, like we had the 3 goals. It looked like housing, homelessness intervention and prevention, and services were the 3 goals that were raised as top 3. And then within those, there was various different actions that were prioritized for each one of those goals as well. So this agenda item appears to be speaking to the action items themselves, not necessarily the goals. So it looks like funding was definitely one of those action items that permanent, identifying permanent funding sources, which I agree is absolutely a permanent, an important topic that also hit on multiple different goals that particular issue was raised. So that being one, yes, Dr. Janelle.
Thank you so much, Dr. Janelle, for the record. I think, and this is where I'm asking for everyone, like in full transparency, like when we talk about possible action to identify the top 3 action items, because we did already support or sort the strategic issues, are we taking the top 3 action items from each of the top 3? So I think that because of the way that this agenda item is worded, it's a little confusing for me, and that's why I'm asking for a bit more clarification from the group, or how do we want to move forward from here? So I would like to know, like when we say top 3 action items, is because if we were to take like number 1, which is housing, there's 3 right underneath that, which is number 1. And then, the way that the survey was designed, or are we taking from the top 3, the number 1 from each of those? Does that make sense? I'm just asking because I don't know.
Right. I mean, I think it's a great question, and we need to sort of make a decision as a body as to how we want to move forward. So I would err on that as far as the need to move that direction forward, but would love any other thoughts about that. I think it should be, because the Interagency Council, they wanted us to hone in on something. And I think we said 3 to kind of stretch that. They probably would want to be fine with 1, right? But 3 topics that, are important for us to advance and to put on their agenda item, so that way they can get educated on those issues and start working through them. So, I would love this body's thoughts based on what we know. What are the most important 3 items?
Can we see the results of the poll again, please?
Thank you, Adrian. I was about to ask that. I was like, maybe we should look at that one more again. And then that way that would definitely be helpful.
Yeah, we've got fund sources that's definitely come up. So the first one was the goals, the strategic issues, and then under that is the action items. So that's the identify permanent funding sources, and that's just for housing though. Develop
Yes,
multi-sector
Dr. Janelle,
housing.
for the record, that was one of the reasons why I asked, because, the action steps versus the actual strategic issues themselves, the way that they're broken down. So when you say top 3, it's like top 3 of what? Like top 3. So is it number 1 for each of the top 3? So we take funding from housing, and then the number 1 from homeless prevention and intervention, and then the number 1 from wraparound. Does that make sense? So it's like, which top 3 are we talking about?
Mm-hmm.
Or take all 3 from housing, right?
Right.
Yeah, I'm just asking for a friend. Thank y'all
What-
so much. I appreciate you.
What do you all think should be the approach we take?
Julie came for the record. I feel like, we do housing, homelessness prevention and intervention, wraparound services, and then the top 3 for each of those. instead of it being 1, 1, and then 1. But is that putting us over any kind of limit? I don't know if we have anything like that.
Julie, Dr. Janelle, for the record, I am totally okay with that. And that's why I said, well, as long as we don't abandon the other ones, because that was what I was struggling with. And so thank you for sharing your perspective on that. And Adrienne, I see your hand is up, so I'm going on mute.
No, that's okay. I think my understanding was that of the 24 action items within these 8 goals, we had to pick 3. And really, probably they only want 1, right? So I think sending 9 is probably a mistake. I think that we should send 3 that we think are both important and attainable. That would be supported by the committee or whoever else needs to have buy-in. But I think that we need to have a real candid look at what our 3 items are based on this and make a decision.
Mm-hmm.
Dr. Janelle, for the record, I think both suggestions are really good. So Adrienne, thank you for bringing that up. So I guess we would have to, now it's a numbers game at this point, because now we've taken 27 things, whittled it down to 11, and now we're whittling it down to 3 or 4, meaning, you know, the selection of said action items, which are embedded in each of the strategic issues. That was what I needed some clarification on. So this is really helpful. So if we were to look at each of the action items under each of the strategic issues to see which ones got like the most, I think that would be really helpful.
I mean, I think this survey gives us a really good narrowing, right? It gives
It really
us
does.
Whittles it down to the 3 strategic issues that we need to be honing in on. So we're not looking at all 8. And I think at that point, it also gives us some priorities within those top 3. It's whittled those down because some of these strategic issues had 8 or 9 different action items, right? So it's whittled down even more. So maybe from this point, maybe we do a survey, take a voting opportunity amongst our committee with the top 3 issues and their top 3 votes, like send that out for a vote to the committee. So we can, you know, determine which of the 3, which of all, you know, if there's 9 different strategic action items that are voted on, of those 9, which are the top 3 that we advance. Does that make sense? Should we take that approach?
Makes sense to me.
Okay.
Dr.
And then
Dr.
yeah, go ahead.
Dr. Janelle, for the record, I was, you know, and thank you all for speaking, Pam. That was where I was looking at, like, let's say those top 9 and whittling it down. But because we have the data here, that was where I needed some help on which way to go, like ranking them within each of the top 3 strategic issues.
Mm-hmm.
So to AP's suggestion, I agree with that as well.
Okay. So we would, and it's not that this body isn't going to do anything with any of the rest. It's just the ICHH is going to focus on whichever ones we advance. And we'll continue to work on the rest, I guess, you know, in terms of planning and strategy. Yes, Adrienne.
I'm sorry, I have another meeting that I have to get to, and I hate to leave in the middle of this conversation, but with all of the uncertainty right now, I need to attend this other meeting. So I would support a poll among these members to select the top 3 based on this poll, based on this committee, to advance to the ICH.
Great. Thanks, Adrienne. That sounds like a motion. Anybody
Dr.
want to
Janelle,
second
for the
that?
record, I second that quick motion, if that's okay.
All right, any discussion on what Adrian's proposed? All right, all in favor, say aye.
I
Aye.
Aye. Any
Aye.
opposed or, yeah, any opposed? Any abstain? All right, so we're going to move forward. So Carlia, if you could help us with that poll to go out to our members to vote on the top 3 strategic issues, the top 3 that were from this poll, so we can whittle those down and have an option to select our top 3.
Okay, sounds good.
Great. All right, so moving right along, we'll close that agenda item. Thank you all. So agenda item number 8, discussion and possible action regarding meeting schedule for 2025. So Carlia, I know we had sent out an email to the members asking about their preference and wanting folks to email you all about what days of the week and the meeting cadence. Did you all receive any feedback on that?
Sorry, I couldn't find the mute button. So for the most part, most of everyone did respond. But we did get one suggestion that we move it to Thursdays at 1 p.m. That was the only other, everyone else who responded, the current date and time works.
Okay, Thursdays at 1 p.m.
Yeah, that was the only other, that was the only suggestion.
Would
May
like
I
the, yeah,
add?
go ahead.
Oh, Dr. Janelle, for the record, since there was only one suggestion, because I think that probably came from me, that was only because sometimes the Council for Food Security meets at that on the Tuesdays, and that's why my attendance was really bad this last year. But would it be possible to, like, let's say, maintain the meeting dates and times that the majority recommend, but then have the alternate be the Thursday at 1 o'clock? Like, for instance, we had to move this meeting to the following Tuesday, which worked, but in the event that we need some flexibility, leave it open for like the Thursdays. Is that a possibility? And I'm just kind of putting that out to the whole group because I don't know if this is discussion or not. So if I'm out of order, please let me know.
Okay, no, this is discussion and possible action.
Do you still have quorum? This is
If
Ryan.
Adrian left, we do not.
Yes, Julie had joined, so we do now.
Oh, okay, okay.
No, okay.
Thank you. So as far as this item, does anybody have any concerns with having an alternate day on Thursday? Because this is, what is this, the 3rd Tuesday of the month, so the 3rd Thursday of the month at 1 p.m. and then alternate.
Oh, Dr. Janelle, for the record, if we were keeping it at Tuesday, then the Thursday would be the alternate. Only when needed. Like, for instance, last week we were not able to meet, so we just pushed it to the next Tuesday, which worked. But then we would also have that Thursday as an alternate, just kind of as a backup to the backup.
Okay.
I hope I expressed that clearly. I apologize if I did not.
This is Chris Murphy for the record. I could not do the 3rd Thursday, but I could do the 2nd Thursday.
Yeah, I could do the 2nd Thursday too.
Julie King for the record. I could do the 2nd or 3rd Thursday. Either one.
Okay. All right, well, since we've got a majority that can do this time, and it does, I think Adrian, I'm not sure if Adrian proposed some other times too, because it seems like she has a conflict as well for the whole time slot. Did the time slot issue also come up, Carlea, as far as, because right now we've got a hold on our calendars for like 90 minutes, or no, it's probably longer than that. 2 hours. We have a 2-hour hold.
Hour and a
So
We haven't received any feedback from that, the time slot itself.
okay.
Yeah, Dr. Janelle, for the record, it was more just like the days. I will have to let y'all know in the month of March, it's going to be horrible for me, only because we're releasing the new McKinney-Vento grant, pending any further federal action. And so like literally March 11th through the 28th, I'll be like reviewing those applications. And it looks like it's going to fall on all of those Thursdays, but I think Tuesday would be okay. So that was where I just wanted to offer like some flexibility for, any of us who do have those obligations. For instance, Mr. Murphy wasn't able to do third Thursdays where he could do second Thursdays. And so I'm just glad that we're having this discussion for the flexibility, because we do know that membership changed and obligations changed too. Thank you.
Great. Okay, Austin, did you have any preference on any of these days, second or third Thursdays?
No, my schedule gets very difficult sometimes in it. So I have this time blocked out on my calendar. And so that makes it very easy. So if we did change or anything else popped up, there is a likelihood that I could attend, but the longer something's in my schedule blocking out that time, the less likely I have conflicts, unless I'm out of the office or something like that.
Mm-hmm. Agreed. Same for me. So thank y'all for getting it out and early and blocking my calendar.
Yes.
And can I also make a suggestion?
Yeah.
The ICHH also hosts their meetings every on a third Thursday, so there may be a conflict depending on when it's like if you have to use it for backup.
So, Dr. Janelle, for the record, would it be advisable to have the backup as the second Thursday of the month, but can maintain our Tuesday meeting blocked out date? Because some of my meetings have moved with the exception of Council for Food Security on the Tuesdays. So like I said, I will go with the majority of what the team is, and then I'll figure it out on my end, because I believe I'm the one that was like the super odd duck.
Okay, well, could we make a motion then to do a doodle poll for the second Thursday or third Thursday? Well, we don't want to conflict with ICHH. I think our meeting should be before theirs. So the second Thursday of the month at 1 p.m., Carlea, would that be appropriate? Yes, Dr. Janelle.
Quick question. So is the second Thursday considered the backup or the actual new meeting time? I'm just trying to ask for clarification, because it was my understanding we were going to keep the Tuesdays, but then maybe keep Thursday as the backup, the second Thursday. I'm just asking.
Yeah, I think it would be a backup as a backup option in the event that we didn't make quorum and needed to, have a second. Maybe we could still have it within the month if we did the second Thursday.
Okay, so Dr. Janelle, for the record, I move that we continue our meetings as scheduled on the Tuesdays, and also have every second Thursday of the month for a backup date in the event that we are not able to meet quorum, or we need to make the adjustments for the Tuesday meetings.
Okay, thank you for the motion. Is there a second to that? Or any discussion?
Just for clarification, are we not going to do the doodle poll then?
Yeah, I was recommending a doodle poll just to get a sense of who can make that as an option. it may or may not work for everybody. Everybody's not here currently, so it was just to kind of assess, would that date and time work as a backup?
So Dr. Janelle, for the record, I will withdraw my motion if needed. My apologies, because there was the discussion of doodle poll. My apologies, team.
No, thanks for clarifying. So Kalia, are you all able to do a doodle poll for us just to assess availability?
Yes, so we'll look into if that's something that we can do, and then we'll send out an email letting you all know.
Okay. Okay, so let's go on then. We'll close this agenda item. And based on the results of the doodle poll, we'll table this for our next meeting, if that's okay with everybody, based on the results. Okay, our next item is for information only, discussion of agenda items for the next meeting on March 18th. So based on our conversation today, we had a pretty robust meeting. Definitely want to have a follow-up regarding the vacancies. And so we'll keep agenda item number 4 on the table. I guess agenda item number 1, 2, 3, 4 stays. The discussion regarding alternative ways or format, we would like for I think our committee members for this particular agenda item to come with your ideas of topics we would want on an expanded spreadsheet and information we want to capture. And then based on the poll survey, that's going to be closed by our next meeting. So maybe we keep number 6 on there and review the final results of the poll. And we keep number 7 as well, because we're going to have our own internal TA poll for the technical assistance work group to determine our 3 action items that we're going to be voting on. That's maybe this agenda is a duplicate agenda. And then the poll, also number 8, the results of the doodle poll related to our alternative date. And number 9. Any other topics? Nope, it's a pretty hefty agenda. All right, we'll close agenda item number 9. We'll go on to number 10 for public comment. No action may be taken upon a matter raised until the matter has been specifically added to an agenda. Comments are limited to 3 minutes. If you're making a public comment via phone, please call 1-775-321-6111. Use ID number 489-058-294 and the # We are now open for public comment. Please unmute yourself and state your name for the council. All right, no public comment? Anything on the phone lines, Carlia?
No, nothing.
Okay, we'll close public comment. Thank you all so much. We'll adjourn this meeting. It is 2:19 p.m. All right, have a
Thanks,
great rest of
everybody.
your week. Thank you.
Thank you all.
Thanks for your service.
Thank you, everyone.